So we're just going to go on an ankle here. So sometimes on an ankle it's a little more bony, and there's some spots that are a little more uncomfortable. You okay there? Mm-hmm. Okay. So basically, sometimes it's hard to describe what's going on when you have this done because it's such a different treatment. So we were just talking about that, right? When it's just a different feeling. It's not. It's sometimes a little shocking to your, like literally, like your body's like, what is this, right? It's trying to understand it, and sometimes it's hard to comprehend. There's like a little cognitive dissonance or something. Like, okay, I know something's happening, and that's part of what this is doing. It's stimulating a body, like it's simulating an injury, but it's not creating an injury. But it gives the body, a response that's basically bringing healing to an area, especially like spots that have scarring and things that have been hurt for so long. It's a really good thing to make sure that we address that, and we can kind of help break things up and get the body jump-starting its own healing process. And then you combine that with rehab exercises, moving well, maybe some manual therapy, things like that, then things may take it to a whole new level. So that's what's been noticeable here is that, we get things moving. It does feel different and weird, but we keep it under control. We make sure, things are comfortable, but we try to address all these spots. And then, how are we doing?
Good.
Okay. Any other spots that need it here?
All in that just feels really good.
Yeah. And we've done this a couple times already, so sometimes it just feels good as we do more. That's okay. Like we want good feelings too. So, but we're also kind of looking around for other spots that are a little more intense. And usually it's down by this ankle here. We'll go underneath the foot here, but yeah. And it's a lot more intense a lot of times here because it's right by the bone. So sometimes the bone's a little more uncomfortable. And we'll address it as we need to. If we need to decrease that, the shock waves there. And then, but definitely more like up here in the ankle. You okay there? Mm-hmm. Yeah. And just finding different spots.
Oh, that's a good spot right there.
Yeah. So just knowing anatomy is what's going on with like certain attachment points. Just knowing that the tendon's kind of looping down through here. We're just trying to address that area there. So, yeah. Keep that right there. And if it's there, if the client says, hey, right there, I'll hold it there, like right there for a little while. As long as it's not too intense. A lot of times, some people will want to grind it out. You don't necessarily have to like grind it out and be like too uncomfortable, but it's okay to bear it up just for a little bit, but I don't want people up over, maybe 6 out of 10 in pain-wise. And I know that's a subjective number, but it's your number. You know what your 10 is. So I don't want you kind of being, sweating and jumping away from me. I want you feeling like you can handle the treatment well. It doesn't take too long. I mean, it just takes, maybe 5 minutes or so to go through the process here. Okay. So that's kind of what we do in the ankle. And then I'll probably also work in the bottom of the foot here. Let me grab a little bit more ultrasound gel. I'll just do that just to see what's going to happen here. Okay. All right, let me just kind of go where that tendon's coming up and underneath just to see what's happening here. How's that?
Totally fine.
Totally fine, no problem. Yeah. And then sometimes as you get to the bottom of the foot, it's thicker tissue, I'll go a little higher in energy. And if it's too extreme, let me know. But all these tendons and stuff attach to the bottom of the foot, so we'll find stuff on the bottom of the foot. How are we doing there?
Totally fine.
Yeah, no problem.
Right there.
Okay, so we found a spot right there. So we'll hold there for a little bit.
And that's long enough.
Yeah, okay. That's enough. Okay.
Too high.
So it's too high. So it's something where, and I worked about my foot. I mean, as a runner, I do this a lot. Like I did this the other day on my foot, and I was like, I don't have any pain in my left foot, but I went along the bottom of my left foot, and I was like, oh mama, it was hot. I was like, what is this? And it's because that tissue just consistently gets torn and ripped, and like all these things over wear and tear over time. So really just as a good even maintenance treatment, still too intense?
No, that's perfect.
But like still as a good maintenance treatment, a lot of runners really benefit to have this done once or twice a month or something, just to get things like just your standard stuff that you're kind of beating up. You'll find things that you can use it on, and that's what I found for myself. Yeah, let's get a little tense. Okay, we'll kind of work our way back up here.
There we go.
Better here. And we'll kind of get into here again. Okay. You okay there? Okay,
Yeah,
great.
just maybe twitch.
Yep. Yeah, sometimes we get a little twitchy because it's kind of creating this little impulse. It's like the reflex hammer, you know, because I kind of hit the reflex hammer. If I bopped your kneecap, your leg would kick, you know. So, okay, pretty good. I'll get worked in the front here, and then right into here again. We'll have you turn your foot. Just there we go. Right there. Is that okay? Yeah. Just try to have her turn her ankle a little bit to expose that ligament there. And yeah, a little bit there.
Yep.
Yeah. So we'll hold there for a little bit. Awesome. Okay. I think that's what we'll give you for now. That was plenty. Okay. Excellent work. So it's kind of just showing the tendon, kind of working on tendinopathy and some irritation there. Also want to work kind of anatomically where the structures you need to address. So, but also keeping in mind that if it can be a sensitive area in the ankle. So, and we have her in this position. Sometimes we'll switch positions to do this as well. But it's a great treatment. So awesome. Thanks.